folks, thanks for tuning in. We're really excited to have Dr. Kyle here. I was introduced to him through Ali Trout, who absolutely adores him, and now I know why. So he's going to speak to us tonight about the endocannabinoid system. We're super stoked to have him. By the way, he normally lectures to doctors. We're super stoked because I know so many people have questions that they may not feel comfortable asking their doctors. So this is the time he's going to address everything. We actually have a few educators here that have been speaking about uses in schools and what's good and what's not good. Anyway, here's Dr. Kyle, and he's going to speak.
Thanks. Thanks everybody for joining. I appreciate you for taking the time to come on out and listen. Hopefully you'll learn some things. I might power through this pretty quickly because I do have a number of slides that I probably shouldn't have so many, but there's a lot more data on what's going on these days with medical cannabis. So first, I'd like everybody to understand the difference between what a naturopathic doctor or naturopathic physician is. So a naturopathic physician is somebody who has a 4-year medical school training that's accredited by the Department of Education as well as regional accrediting bodies. We also, some of us go into using our skills to get into a residency. That's what I did. I did my education in Portland, Oregon for 4 years, and then I followed that by going to a residency in Atlanta, Georgia for a couple of years. And from there, I've been in southern New Jersey in Cherry Hill, doing basically functional and integrative medicine with a focus on medical cannabis, hormones, and digestive issues. So today I'll be speaking in regards to medical cannabis and the endocannabinoid system and terpenes. So to start off, we're just going to go through, typically I do show everyone a video on Charlotte's Web and how that was developed. Charlotte's Web is a strain of high CBD, cannabidiol, and that typically helps with a seizure disorder called Dravet syndrome. This young girl was debilitated, having hundreds of seizures a day, and she found a group of men who are growing high CBD strains in Colorado, now called Charlotte's Web, on a type of cannabis that was cross-hybridized to have more CBD than THC, so less of the psychoactive components to things. And what they found was once they gave their daughter CBD, high doses of CBD, she was having 1 seizure or 5 seizures a week instead of hundreds a day. And so that's kind of where the journey starts. You can find that on YouTube. It's a CNN special with Sanjay Gupta. There's Weed 1, 2, and 3. Weed 1 goes through Charlotte's Web story. But today we're going to talk a little bit about cannabis as a medicine and the history of that, as well as hemp and cannabis, aka cannabis in America, and moving on to hemp versus what we call marijuana these days. Overview of endocannabinoid system, cannabinoids, terpenes, research, safety. So in terms of its earliest documentation in history of cannabis, it's been documented to be used as a medicine since Chinese emperor in 2700 BC had used it as a medicine in his book on the treatment for many conditions. We also see it dating back into the 1600s in India in texts from India, using it as a medicine for anxiety as well as other common ailments. In Mesopotamia, we had tablets from 1500 BC that also showed it being used for depression as well as in different recipes. The Egyptians used it a lot, not only for religion and culture, where they would use it as a ceremonial offering, but they would also use it for various issues like ear blockages, cuts, tumors, which we consider cancer these days, digestive issues, cataracts, glaucoma, and then muscle aches and gout, and even shaking disorders. Egyptians as well as Greeks used it in veterinary medicine a lot. And then we also see that it was first documented to be used recreationally by a Greek doctor called Galen, who in the 2nd century used it for being cooked into desserts and eaten at parties for recreation. So recreationally, it did start around 200, common era, and we're seeing it used nowadays as a recreational use as well. In hemp in America, it was first grown in around the early 1600s when we had British colonies coming in. British colonies. The British were forcing the natives, the native colonists in America, to grow this for them. And they were required, each household in 1690, to grow 100 plants for each household. And so by 1682, we see that hemp was being used to pay off debts, including your taxes. Leading up to the Revolutionary War, the Britons wanted to prohibit colonists from manufacturing their own goods, except in small amounts, but colonists decided to continue to make hemp. And as a result, they used that money to sell. They used the hemp to sell to France, who was not the British allies, and we ended up using our money from hemp to get weapons to fight the Revolutionary War and to fight off the Britons. So once the Revolutionary War began in 1775, we exported it to France and we used it to exchange for weapons for war. And it was first listed as a medicine in the U.S. Pharmacopoeia in 1850 rather. So that's where we first see it coming up as a medicine in America. Doctors started to use it for things from gout to tonsillitis to snake bites to tetanus. Hashish tinctures became available over the counter. They were very, very widely used. They would even use them mixed with what was basically powdered corn to put on bunions as well for pain and healing. Then we saw it used for diarrhea. So the first usage for diarrhea in America was morphine, chloroform, and cannabis, which is a heck of a combination, you know. If it doesn't stop you from having diarrhea, it's going to stop you from doing anything else you want to do. Right, exactly. It was used as a sedative, and then it was also first documented in Lancet, which is a medical journal that's very prominent. In 1899, Dr. E.A. Birch recommended it to be used for opium withdrawal. Because opium and opioid use disorder has been around for hundreds of years. And we've known that this medicine can be used to help with opioid withdrawal. And despite the progress we made in cannabis, the problem was that it was used as a liquid extract, and typically the concentration would get stronger when you started getting to the bottom of the bottle. And consumers didn't like the different effects, the psychotropic effects, by the time you got to the end of the bottle. And around that time, around 1899, aspirin was manufactured. And so that started to replace cannabis use as a medicine because it gave you a standardized dosage of a synthesized compound, and you didn't have that inconsistency amongst, you know, whether you were going to get the euphoria or the high effect because you were using a liquid extract, because people would forget to mix it. So I had some slides, I had some things to show, but in the 1899 Merck manual, I'll show a couple that people are here. There were dozens and dozens of conditions that it was touted for as a medicine. And so I guess you can't see it on here, but the main ones that we also see it being used for today is dysmenorrhea, or painful menstrual cycles, heavy menstrual cycles, epilepsy, headaches, migraines, opioid habit, pain, and uterine cancer. So those are among the main things that we see it being used for today, or being accepted for as a medicine today. But I have a version of the 1899 Merck manual, and digging through it, I saw a lot of different uses for it. So cannabis became marijuana in the early 1900s when it was associated with Mexican and black populations, and they were viewed as thugs and thieves, and so it was associated with those populations. And so since most of the politics and most of the government was Caucasian, they started to turn against this as something, and they started to identify it with those populations. Despite that, there was a research study that was the first research study done in 1921 on an army base at the Panama Canal as they were digging it, and they found that many of the Americans using it for many ailments, pain, just to get through their work days. And they said, wait, we need to do research and see if this is affecting their productivity. And from the research, they found, quote unquote, no appreciable deleterious influence. And so they said, there's no harm in using it because it's not affecting productivity in the workplace. And so despite that, many states by 1934 started to put restrictions on it, and at that time, at the end of 1933 is when Prohibition ended, and so public intoxication was something that was seen as dirty, and so that's where they started to say, oh, well, if you're intoxicated, whether it's cannabis or alcohol, then that's considered something that's a detriment to society, basically. And so at that time, there started to become propaganda around the mid-1930s, especially with Henry Anslinger and a movie called Reefer Madness, which basically associates cannabis use with violence and murder. And so we know that it doesn't create that type of effect, but by August 2nd, 1937, it became illegal to produce and to use, etc. But there are many differences between what we consider hemp and marijuana. There are three main differences. One of the main differences is the amount of THC. So THC is tetrahydrocannabinol, and delta-9 typically, and that is very high in marijuana, which is the female plant of cannabis. It has the flowering tops, whereas hemp is the male plant of cannabis. Typically we see little testicles, if you will, little balls or sacs, and that tells us that it's the male plant, and that grows very rapidly, very easily. It's not as susceptible to fungus or molds or things like that, or even pests like mites, but the flowering plant of cannabis is much more moist and sticky, and so it is much more susceptible to mites as well as fungi. So the one big difference is the THC content. The second big difference is cultivation. We're seeing that you can grow hemp anywhere, whereas cannabis, you may have some difficulty with growing it, and you need certain parameters to prevent any mites or fungi to get on it. And so recreational cannabis, if you're getting it off the street, if you will, that's why we need to be cautious of pesticides and fungicides being contaminated in these plants. So we want to make sure that we're getting them from a valid source. But basically the biggest difference is marijuana can have up to 33% THC. That's been found in Oregon when police pulled somebody over. 33% THC is insane because in the 70s, THC content was typically 5 to 7%, but now we're seeing it in most dispensaries as high as 26%. 33% was the highest I've ever heard of. But we've cross-hybridized this plant to be mainly used recreationally, and we know that it can be used as a medicine, but we also know that sometimes you just overstep that and you start to get into recreational. Now there are two different main receptors that we have throughout our body in the endocannabinoid system. CB1 receptors are predominantly associated with our nervous system and along our brain and spinal cord, and we also have CB2 receptors, which are typically immune receptors that are located in the thymus, which is one of our main immune organs, as well as in our gastrointestinal tract. THC binds aggressively to both of them, but typically more aggressively to CB1. And then we have CBD that kind of modulates those receptors. It doesn't really have a strong bind on them or strong affinity, but it does help to support them and support the immune system along the way. Now, in the endocannabinoid system, it's a system that evolved about 600 million years ago. It's in every single vertebrate. It's in every single mammal. We know that it's in nematodes and sea squirts, and it's been developed as an essential part of life in order to adapt to environmental changes, whether they're physiological or physical or emotional, and that's what its main claim to fame is. So basically the cannabinoids influence a person's relationship with their external environment. So we all need that, right? But not just cannabis upregulates or activates or deactivates this system. We have our own production of endocannabinoids, which I'll get into in a moment, that we downregulate if we have certain behaviors. And so it helps to mediate neurogenesis. So in my opinion, any athlete that has a concussion or a post-concussion syndrome should definitely consider using some type of cannabinoid medicine in order to protect neuroprotective effects and to help neuroregeneration, and so that we don't have some of that memory loss. I myself have had at least 20 concussions in my life, and I'm lucky to know some of the things that I'm talking about today. But cannabis medicine is definitely something that should be implemented along with hyperbaric oxygen therapy to help with recovery from that type of trauma. Socially, it alters human behavior by promoting sharing, humor and creativity. And so we see that in various other populations, like in the jazz scene. There were other things that they were getting into as well. But we know that a lot of artists have used it for helping to open their minds to creativity. And then we can see that they're activators and sensitizers in injured tissues. So basically trying to prevent your nervous system from saying there's pain, danger, danger. It helps to downregulate that response so that we're not as sensitized to pain. So inside our bodies, we have two main endocannabinoids, things that we produce ourselves. One's called anandamide, the other one's called 2-AG. And these things have a huge effect on our bodies overall, and they stimulate these CB1 and CB2 receptors. One of the main things that helps with activating or enhancing our endocannabinoid system is actually omega fatty acids. So fish oils are critical because fats are a precursor to anandamide. And so if we artificially suppress our triglycerides, which are one of our fat molecules in our blood chemistry, then we will not make efficient amounts of our endocannabinoids. So that's why we need to be cautious about statin drugs at reducing our adaptation to stress, etc. We also have various herbs like echinacea that can help to also stimulate the endocannabinoid system. It's not just about cannabis or CBD, but there's other herbs. Chocolate also does some stimulation of the endocannabinoid system. And then stress reduction techniques, especially enjoyable exercise. So I found enjoyable exercise as an interesting statement, but that's part of the attributes to that runner's high, if you will, is related to upregulation of our endocannabinoids and stimulation of our endocannabinoid system. Things that downregulate the endocannabinoid system are chronic stress. We also have endocrine disruptors, things like pesticides, herbicides, solvents, and even scratched up Teflon pans, microwaving plastics, and also crimpling plastic bottles. Those are things that are huge, that impact the system in a negative way. Fried foods, and specifically vegetable oil like canola oil, are also things that downregulate our endocannabinoid system. Chronic stress, chronic alcohol consumption, refined sugars, and trans fats. So we want to be very conscious about those things because we know what impact they can have. Now there is something called the entourage effect, which we should be conscious about for every herb, but especially cannabis. The entourage effect is when we basically have CBD and THC are single extracts from this plant, right? So in order for us to be able to get the best usage of this plant, we need to also look at other cannabinoids, CBC, CBG, CBN, as well as terpenes. So terpenes are critical. And we will go into a more extensive discussion on terpenes, but those are the things that make flowers smell good, that makes food smell good, and also what allow us to, see essential oils do the work that they do and give us the clinical improvements that we see. So the entourage effect is basically, one chemical can do a lot, but if we have all of the chemicals together, they're going to do a whole lot more for our system, and we'll need less THC and less CBD to get the job done. We also have a precursor to our CBD and THC called CBG, so cannabigerol, gerolic acid. That's something that's a precursor, and this is by far the most important endocannabinoid. Basically, it's like our bodies have stem cells which become whatever we want them to become. That's what CBG is to THC and CBD. And so if we didn't have CBG, then we would not have THC or CBD. THCA is one of the breakdown products of CBGA. THCA is fantastic for cancer. The best way we can deliver this is by juicing the fresh plant. Unfortunately, in states like New Jersey and New York, we don't have access to growing rights, and so therefore we can't juice fresh plant. But that would be the ideal situation. The goal for cannabis dosage of THCA for cancer is going to be 100 milligrams of THCA and 100 milligrams of CBD. I've had a number of patients that have had spontaneous remissions in cancer just from using cannabis as a medicine, complementary and or alternative to the standard of care. But you should speak with your oncologist whether that's a beneficial substance for you or not. We also see that it's very anti-inflammatory, THCA, and it has no psychoactive effects. So we typically see that in more of the higher cannabis strains. But what happens is THCA breaks down into THC from heat, from baking, from lighting the cannabis, or from the drying process. Those are the three ways that we convert THCA to THC. So if you try to make cannabis tea, you may have some benefits, but you won't have as much of an effect because you have not created that combustion reaction to break down THCA to delta-9 THC. Delta-9 THC is very high in anything that is a Kush or OG variety, and so those are very high in THC, usually in above 20% THC. We see great anti-cancer and also anti-nausea and vomiting effects, but we can also create vomiting. There's a syndrome called cyclic vomiting syndrome that can occur from THC overdose. I had a patient in Pennsylvania who was given a cannabis tincture that was against my recommendation. That was a very high THC tincture. She was cannabis naive, so she had never tried it in her life. She took it, and she had cyclic vomiting for 8 hours. I know a cousin of mine who's unfortunately no longer with us. He used cannabis for a long time for his PTSD, but he triggered cyclic vomiting syndrome for him, and unfortunately he was no longer able to use that as a medicine. But we see it as an appetite modulator, especially when we eat it orally. We see that it starts to down-regulate appetite more than it up-regulates appetite. Now, indica varieties of cannabis, although indicas are more true indicas and sativas are all over the map, and we don't know how your response is going to be with those, the indicas do typically have more of an appetite stimulation effect rather than a modulation effect. But sativas, depends on the individual. You're going to have to try it and see how your response goes. But we do see that Pearl Girl Scout cookies, Bruce Banner, head cheese, as well as any OG or Kush variety are huge when it comes to THC. And we can see it also helps with chemotherapy side effects, especially cachexia or weight loss. Now, there are certain drugs that are available that are synthetic THCs. So we have Marinol and Nabilone. So these are synthesized typically from sesame seed, and these things are used for weight loss and HIV and AIDS, and also nausea and vomiting associated with chemotherapy. The Marinol is a Schedule 3 drug, whereas the Nabilone is a Schedule 2 drug. Cannabis itself is Schedule 1, which means it has no medicinal properties, which is kind of ridiculous. But we can synthesize this into a pharmaceutical, and we can say it's not, it does have medicinal properties. These drugs are effective, however, we don't have that entourage effect, and therefore we have a higher side effect profile. So there's much more reported adverse effects from that. Now, after we go from CBG, we can go down to THCA and then to THC, or we can go to CBDA and then to CBD itself. CBDA is non-psychoactive, so no matter how much you take, you'll never have the euphoria effects. Definitely has some anti-inflammatory impacts. We see this high in Ringo's Gift. It was named after a child who had epileptic disorder. It's typically a 24-to-1 CBD to THC ratio. We also have the AC/DC, which is 20-to-1, Harley Quinn, which is 5-to-2, CBD to THC, and then we have Canasu. I've seen at New Jersey dispensaries, but I don't see many of the other ones except for maybe AC/DC at New Jersey dispensaries. New York dispensaries do have them from time to time. So typically, we're going to use those for inflammatory psychiatric disorders and nausea and vomiting. And now, after we break down the CBDA, we have CBD. So CBD is all the rage nowadays. The CBD you get at your corner store is not going to be the same CBD you'd get from a medical provider like myself because of the terpenes. We need to make sure that whenever you get a CBD product, you contact the company and ask for a certificate of analysis. A COA ensures that a third party came in and tested that product, made sure there's no pesticides, herbicides, heavy metals, and it gives us a cannabinoid profile as well as a terpene profile. And so we want to make sure that any CBD product we use has that profile. Because if you look at the corner store and you see hemp oil, it doesn't always have CBD. It has the omega fatty acids from hemp, which can help upregulate the endocannabinoid system, but it doesn't have the CBD. And so you want to make sure you're reading the label and you're asking for the company to provide you with a certificate of analysis. So CBD can be used for virtually any disorder that's related to inflammation, pain, as well as anything that's immunological. So we have cancers, we've got autoimmune disorders, etc. We can also use it very successfully for epileptic disorders. Typically for epilepsy, you're going to need higher dosages. I've had patients get off of seizure meds by using 100 to 250 milligrams of CBD and have complete success and no seizures. But you need to make sure that you're getting a good quality product and you're using it under the supervision of a licensed professional. If it doesn't seem CBD is helping for a child for epileptic disorder, then you would typically add a little bit of THC and you will have success with that. But the goal of this medicine is not to make you high. It's to give you symptomatic relief without creating the euphoria. Now, there is a drug in June of 2018 that's CBD synthesized called Epidiolex. It is a Schedule 5, so instead of Schedule 1, 2, 3, or 4, it's all the way down to Schedule 5, and it's being used for Dravet syndrome, which is a very severe seizure disorder, as well as Lennox-Gastaut syndrome, which is another severe seizure disorder. The problem is that we also don't have the entourage effect with this, and so we see the side effects of diarrhea, as well as appetite changes, vomiting, and elevation in liver enzymes. We'll talk about which medications you need to be cautious about using with CBD and THC, because there are that can create an adverse effect. So we will be discussing that towards the latter part of this lecture. The therapeutic effects of CBD are antibacterial, anti-cancer, neuroprotective, anti-anxiety, anti-inflammatory, anti-diabetic, anti-nausea, anti-spasmodic, pain relief, immune modulation, bone density growth. We also see that with CBC and CBN. Psoriasis, we see it reduces the risk of arterial blockage. It reduces small intestine constriction in things like small intestine bacterial overgrowth or various other types of IBS. And it also is vasorelaxant, so relaxing, so it relaxes those vessels of your body. CBDV is starting to get more attention, but we don't have many products that have that in it. There's a couple of nutritional supplement companies that are starting to derive CBDV. More and more research is coming out on this and THCV, but we don't know as much about it. We just know that it's not psychoactive. THCV is less psychoactive. Delta 9 THC, we talked about a little bit, but that's something that's going to create that euphoria, so we need to be cautious about using that. And then once again, we have CBC, which is good for bone density, and 3 Kings is the best strain for that. Terpenes are the little crystals on the cannabis, and also what makes it smell and taste the way it does, and what other plants smell and taste the way they do. It's also found in essential oils, and it's basically non-essential, but it's for the viability, but it helps enable plants to prosper in their own environment. So the first one is alpha-pinene. Alpha-pinene is a terpene that can be very effective for pain, but it can be inflammatory for anxiety. And so in states like Pennsylvania, where we can see the terpene profiles of cannabis strains, we can tell patients if you have anxiety, you need to avoid strains with alpha-pinene. Things like Jack Herer, although it may be effective for pain, it's not going to be effective for the anxiety effect. And that's going to be very dependent upon the individual. We do see a lot of neuroprotective effects. Alpha-pinene we can smell in rosemary as well as in pine needles. And we see that it can also help with ulcers and respiration. So there's a specific strain called strawberry cough that causes you to cough, and it's good for any type of respiratory condition as an expectorant. In case you have any mucus in your lungs, that is a good strain to use for it. But if you don't need to cough up any mucus, then it's probably not the best strain for you. Beta-pinene is typically in cumin seeds as well as in hops, and it has a piney or woody aroma, great for supporting cancer as well as nausea and sedation, so it's good for nighttime relief. We do see that high in things like Jack Herer and Island Sweet Skunk and Blueberry Dream, which is pretty accessible, but that's something that can also have some anti-diabetic properties. Anybody that I recommend using cannabis, I talk to them about side effects. I'm just going to go into this now. We can see changes in blood pressure, changes in blood sugar, and also changes in reaction time. And so that's why we want to make sure we take it first with a food, because it can drop your blood sugar or drop your blood pressure and make you very lightheaded, or make you shaky and a little bit hangry, especially if you're someone that definitely gets hangry. I get hangry, so I feel you. Limonene is probably one of my favorite terpenes because I know that strains that are high in this help anxiety. So lavender is one of the best strains that we have access to that has the limonene. It's also found in rosemary and fruit rinds. So when you crack open that orange, you can smell some of that limonene. Limonene is good in, it's also in super lemon haze and sour diesel. Definitely gives some stress relief because of that. We used to have, some of our classmates would have rosemary sprigs on their desk to help with, helping some of that memory and that neuroprotective effects while we were taking tests. And some of that was related to the limonene and that citrus aroma present in there. We also have myrcene. Myrcene is the highest, is the most abundant terpene in cannabis, and so we see that this is mainly where it's found in nature. Myrcene, it makes up as much as 65% of the terpene profiles in a lot of strains. So myrcene's biggest claim to fame is pain. Anything that's high in myrcene is going to be very helpful for pain. So typically any Kushes or White Widow is going to be very, very helpful for pain, and then we can also use it for insomnia. So this typically has an aroma like a musky, earthy aroma like cardamom or cloves. I use cardamom ground up in my coffee, and it tastes very delicious. We also see this found in lemongrass. Beta-caryophyllene is the only terpene that attaches to cannabinoid receptors, and so we can find this in strains like Super Silver Haze and Skywalker OG. We see a lot of pain relief with this, as well as anti-inflammatory effects and neuroprotective effects. We do see some antidepressant and anticonvulsant and alcohol withdrawal support for this specific terpene as well. The linalool is another one of my favorites. So this is also high in lavender and in lavender strains. We also see it in LA Confidential, which is available in Pennsylvania and New Jersey dispensaries. Typically we can't, with cannabis these days, people have just put so many labels on it that there's no consistency among strains. So you can't say, OG Kush here in New Jersey is the same as OG Kush terpene profile in New York, is the same terpene profile as Colorado, and the same terpene profile as California, because people have just basically made stuff up all these years and said, well, this sounds good, so we're just going to call this OG something. And that's the difficulty in making cannabis a medicine and directing it towards condition-specific things. It definitely, the linalool has more of a spicy effect. We find it in mint and cinnamon and lavender, as well as coriander. Humulene is another one of my favorite terpenes because it's in hops, and I'm a huge beer guy, so I like humulene. Humulene has more of that earthy or woody effect, and it has a calming impact. It also has an appetite modulation effect, so we do see some benefits in this with cancer. Girl Scout cookies is a big one that has this, which is accessible a lot of places. And then we also have sour diesel and Skywalker, or any OG variety, is very high in humulene, but it has an earthy or woody aroma. And then our last terpene that we'll discuss is terpenol, and that's going to be in lilac. So the lilac bushes, you're going to have that floral aroma. That's going to be terpenol, and we see that as a big anti-malarial effect, as well as an antioxidant and an antibiotic. So we'd want this in our topical cannabis things for when we have an infection. Or if we have a liquid extract of cannabis and we're hiking or we're walking and we fall, we can put that on a cut if it has high amounts of the terpenol. We also see it in eucalyptus sap and pine trees and lime blossoms. That's biggest in, like I said, Girl Scout cookies and the Jack Herer. Now, the evidence of the entourage effect is shown by pinene helps to counteract the compromised cognition and memory caused by THC. We also see data in mixing terpenes, linalool and limonene with CBG that shows promise in treatment of MRSA, so that's something we would use topically. We also see CBN plus THC helps to enhance the sedating effects. So that's why we want to make sure that we're looking at all of these terpenes and all of these cannabinoids. And then we see linalool and limonene combined with CBD can be used for anti-acne treatments. So whenever we're using topical therapies as well, we also want that certificate of analysis, or COA, to ensure that the CBD product we're using, or honestly any nutritional supplement we're using, has a certificate of analysis to ensure no contaminants, and what's in it is what it says is in it.
Can I ask
Sure.
a question? So, as you know, on the plan, we test people's reactions to everything, and I was often seeing an uptick of 0.2 to 0.4 in weight with CBD oils, indicating that while it might have provided some health benefits, it was also causing some level of inflammation. And we finally found one thanks to, we have a naturopathic doctor in Colorado, and she found this one brand that is universally low inflammatory for everyone. What would be some of the reasons that a CBD oil would cause inflammation?
Basically it being contaminated. And so the same one that you'll get at the mom and pop shop across the street is not the same you'll get in a doctor's office. And so that's why you want to make sure.
These were ones that were in doctor's offices. So I'm just wondering, are there certain conditions in which it's grown, or what could be some of the reasons a CBD oil would cause inflammation?
It would be the terpenes. So the terpenes, you may have missed it, but the terpenes are the things that make flowers smell nice, and the reason why essential oils work. And so certain people respond negatively to certain terpenes. Not every CBD has terpenes, but we need that to help with making that substance its most effective for inflammation management. So we can see inflammation modulation. We need inflammation for wound healing. So if we don't have inflammation, we don't have a blood supply, we don't have wound healing. And so therefore, we need these other terpenes to be able to counteract some of those potential inflammatory effects. So alpha-pinene is something that I've found in cannabis, or even in CBD strains, that can actually worsen anxiety and worsen inflammation and pain because it has high amounts of the alpha-pinene. And so when we use things like beta-carotene or myrcene, we see that there's a downregulation of that inflammatory effect. And so looking at that certificate of analysis is critical in understanding what terpenes could be creating an inflammatory response in those patient populations. So now, what was the sample size? Was it, like 40 people, hundreds of people,
I would say hundreds.
Okay.
Hundreds of people do work.
Yeah, so I would say,
so we finally found one brand that seems to work universally, so
Right.
I was just wondering, could it be some sort of pesticides, the land that it's grown on, like why?
Yeah, pesticides and herbicides are definitely a big problem with any cannabis-derived medicine. So hemp and cannabis are the same, so CBD derived from hemp is still from the cannabis plant. Typically, hemp doesn't require as much pesticide and herbicide and fungicides as cannabis itself, but when you're large mass producing, you may start to have those contaminants slip in there. And so some companies will have their levels of their pesticides and herbicides at under the low detectable limit, and some will have them at 0. And so that's why you want to try and find those types of CBD products that will be closer to the 0, even though there's it's acceptable to have certain levels of these pesticides and herbicides in there. We want 0. So I would say not only the contamination, but also the terpene profile. So sometimes it's because you're pushing alpha-pinene as your terpene, but you don't have myrcene, you don't have linalool, you don't have the other terpenes, the terpenol, etc., to counteract those potential inflammatory effects of other cannabinoids or of other terpenes. So that's the big factor. I mean, it's the complexity when you start looking at the chemistry of it, it goes to a whole nother level. And we'll start digging into the science in a minute in terms of what research is out there right now, but it's still early. Like if you ask a psychiatrist, hey, would you recommend this for your patients? They're gonna say no, because randomized controlled placebo-blinded trials aren't typically being done because you can't really patent a natural substance. So it makes it more challenging to validate its use as a medicine and standardize the dosing as well. But I would say all of those things, terpenes, cannabinoids, and also the pesticide, herbicide contaminants. So, yes?
No, sorry, Doctor, what was it that you had said about, you gave an example that sometimes a person had used it, and it created like an angry response in the person, and it completely different response than what most people have. Can you just repeat that little bit again?
Yeah, I found that alpha and beta pinene typically are the terpenes that are more likely to create that aggression or worsening of that anxiety. Although for the majority of people it can help with pain and inflammation, it can also go the other direction if it's too high in a concentration. So it can worsen pain, it can worsen inflammation, and it can also worsen anger and anxiety, and even the paranoia along those sides. So
would you say if somebody knew that they were susceptible to these, that they would be looking for a certain profile in?
yeah, exactly.
Very cool.
Yeah, and I mean, I think that's the future of cannabis as a medicine, is being able to understand, okay, what does lavender essential oil have, and what strains of cannabis do we have in it, so that we can use it for anxiety support, or calming down the nervous system if we're constantly in a fight or flight stage, or if we need to unwind to go to bed. You know, being able to find terpene profiles that are high in linalool, which is what's high in lavender essential oil, which is why it has its impacts on bug bites and itching, etc., topically, then we also want to find those in CBD or cannabis products as well. So I believe that's the future of medicine when it comes to cannabis, and that's why I'm compiling data from the patients that I see and getting their feedback on, hey, what strains are working for your anxiety, your migraines, your pain, your cancer, and then applying that in a clinical world and saying, this is the type of CBD product you'll want to get, because sure, not all CBD products are created equal, and not all CBD products have the same terpene profiles. So, you know, if you have a high alpha pinene, you might start seeing that inflammatory response, where you'd rather have that topically to help with bringing blood flow and wound healing to the area, but you don't really want it internally, you know? So I think that's going to be really the future of using cannabis as a medicine, even whether it's CBD or cannabis itself. So typically the highest linalool strains I found for anxiety, I put that one slide together because I didn't have time to throw pain slides together or anything, but typically Girl Scout cookies and lavender are the best ones that I found. We also see that Do-Si-Do and Cherry Diesel are also very good. So those are just some funny names. Now there's some research updates that I wanted to talk about. So we have some recently in a Journal of Pain 2019, we found that migraines were significantly improved by using cannabis itself. So what it was on about 19,000 migraine episodes, and so it's a large sample size, right? We want to use more than just 100 people or two. And what they found was headache and migraine ratings were reduced by nearly 50% after using cannabis. And then they also found that the cannabis concentrates were related to a larger reduction in headaches than the cannabis flower or the raw herb, the dried herb. And so the evidence for this medicine for medication overuse headache was not detected, which means that we don't see a tolerance. We don't see, you know, things like other medicines where you say, oh, I need more Xanax for anxiety, or I need more opiates for pain. We didn't see that when it came to migraine headaches in this trial.
So you're talking about a trial, a scientific trial. What was the placebo used? Was there a placebo used?
This trial was not a placebo-blinded trial. This was people who reported migraine headaches, and they did symptom scores before and symptom scores after each migraine episode. Yeah. Yeah. So that's what they found. The next study was done in the British Journal of Pharmacology, and it has shown that CBD-induced disruption of fear memory consolidation was altered. So what they did was, it was an animal study, and they exposed mice to a fear response, and they gave them CBD immediately after, and what happened was the mice did not remember that fear response. So basically, it did not create PTSD. So that's why we can use this right at the onset of an episode that's traumatic, and we can reduce the likelihood that it's going to cause long-term effects of PTSD in a human brain. So that's pretty significant. You know, we did see that a lot of it was related to anandamide, our own endogenous cannabinoids, being upregulated and attaching to those CB1 and CB2 receptors in the dorsal hippocampus. So the next thing we saw was 2019 in Frontiers Cell Infectious Disease and Microbiology. 2019, they used CBD with an antibiotic, and they found that there was less antibiotic resistance against MRSA and various other antibiotic-resistant infections using CBD as well as the antibiotic. So we're seeing that it can start to be used for antibiotic resistance when it comes to severe infections like MRSA. And that was 2019. Another 2019 in the American Journal of Psychiatry in May found that CBD reduced cue-induced craving and anxiety in people who were in heroin use disorder. And so basically what it did was it reduced that cue and that desire to use heroin after they had used it. And so it basically reduced their need for that medicine. So it's another study that had showed that we can use this for opioid use disorder by helping to reduce cravings and also to reduce that anxiety response of, oh, I need my next fix. There was a study done on 9,000 people from over 5 years, and they found they were recreational cannabis users, and they found that there was a 30% reduced risk of constipation in these users. The reason why this is important is because it's always been thought that it's used for diarrhea and it's not used for constipation, but really it's used for bowel issues, so bowel modulation. So I have a patient right now using cannabis for gastroparesis. Gastroparesis is a stomach disorder. Her transit time is 48 hours, so it takes her 48 hours to move her bowels, and the cannabis has definitely helped to improve her transit time by at least half. Now she is on a tube. She does have a tube to drain her bowels, but it is significantly reducing or improving her transit time versus what she had been doing. So her quality of life has improved significantly. We also saw a study from 2019 that showed that cannabis does not actually reduce semen production, despite popular belief in recent research. It actually has a huge impact on modulating semen production in the male testes. And so it was always thought that this is something that men who are infertile need to avoid, but it is something that we know that cannabis and the endocannabinoid system regulates the production of semen from the testes. So it doesn't reduce semen production, it modulates. So that's where we need to understand plant medicine, that it modulates appetite, it modulates digestive disorders, it modulates inflammation, it modulates the immune system. We also saw a study on the safety and efficacy in elderly patients, because we know that the highest growing population of cannabis users is those who are over 65, and it's because they want to get off polypharmacy and start to have better management of their pain, their blood pressure, their blood sugar, their anxiety without polypharmacy. And what they found on the 2,000 patients that they had used it, they found 93% of them reported an improvement in their condition and reported that the pain level was reduced. And they found that after 6 months, 18% of them stopped or reduced their use of opioids. And so that's a huge deal when it comes to opioid use disorder, you know, and also the ability to use this as a medicine safely in those who are over 65. Now, we do need to watch out for dizziness and lightheadedness when it comes down to that population, but it can be used safely if done under the guidance of a medical professional. I typically start everyone on 2.5 milligrams of THC at dinner time, and I tell them to see if they feel funny 2 hours later, and if they don't, then they can try using 2.5 milligrams up to every 4 hours as an oral medicine. So that's how I introduce it into people who are cannabis naive. Another research study from 2018 showed that 33,000 cannabis users, they found that they were associated with a lower body mass index, and so despite the munchie effect, we see that most cannabis users are actually at a normal BMI. And so we know that that also shows us that appetite modulation is a huge factor. And then there was a study on 117 people. It was a double-blind, randomized, multi-center, placebo-controlled trial on male and female patients who had been using opiates for at least 1 week to relieve pain associated with their incurable malignancy. and what they found was that there was a statistically significant improvement in favor of using THC in combination with CBD compared with the placebo, whereas the THC group showed a non-significant change. What this revealed was that there was twice as many patients that took THC CBD that showed a reduction of more than 30% in their pain scores compared with placebo. So that goes to show and emphasize the entourage effect. We also saw that in 2007, it can be used for prion diseases, things like mad cow disease. And so there are many, many dozens and dozens more studies I have in here that I will not go over. But the conditions, there are many. New York medical cannabis laws can qualify people for cachexia, cancer, HIV, AIDS, as well as ALS, Parkinson's, MS, inflammatory bowel diseases, post-traumatic stress disorder, and chronic pain. Yes.
The question is that I have anecdotal evidence of cannabis being used to modulate multiple sclerosis. How does it work in that?
So the question was being used for multiple sclerosis. Right now, to lessen the effects. So the primary response in that is going to be for neuropathic pain, so pain related to nerve origin, as well as the spasticity that's associated with that. Now there is a drug that's out there right now called not Epidiolex. Can't remember the name of it right now, but it's put out by GW Pharmaceuticals in Great Britain, and it's a 50-50 CBD THC strain, and that's being used in clinical trials now as a buccal spray to help with reducing the spasticity response. And so if you're using it for MS, you should be using a 1-to-1 ratio. Yeah, it's going to be predominantly spasticity, pain, and inflammation related to MS, and it's going to help with a lot of that immune modulation so that it reduces that chronic, degenerating effect on the myelin sheaths. So it kind of protects things from doing that. So it's called Sativex. Thanks, Cal. So yeah, now I do have if anybody's interested and they're in the state of New York, I do have a medical marijuana doctor that I do work with. Her name is Dr. Zablosky. She's in Brooklyn. Typically the easiest thing for her to be able to qualify people for are going to be cancer-related side effects, as well as documented pain. So if you have documented pain from your doctor, she may be able to help qualify you. And if anybody wants her number, I'd be happy to share that with you. But that's the predominant thing we'd be using it for. In New Jersey, I do help qualify people for medical cannabis, and I guide them in their dosing. Right now, I'm predominantly qualifying people for anxiety, migraines, chronic pain, and cancer. But we also have painful menstrual cycles was added for women, as well as inflammatory bowel diseases and ALS, MS, etc. I do have a couple of patients on it for MS, and they are responding well. It's very challenging to find some of those doses, but it can be very, very effective. And then I have 1 or 2 for PTSD. I haven't gotten into opioid use disorder because honestly it hits a little close to home, because I used to, I know people who have had those issues in my family, and I've had my troubles with things in the past as well. So New Jersey cannabis laws, you can have up to 3 ounces a month. Typically it's $100 for a 2-year card, and we qualify people for a year for $250 after they have an initial office visit, but you're not allowed to grow. Yes.
So I'm about to get a New Jersey card.
Mm-hmm.
So you said weed. Do you also do work in New Jersey?
Yeah, I work in Cherry Hill, New Jersey. I drove up here from there today.
I see. I would like to talk to you.
Yeah.
I have a neurologist I'm seeing.
Yeah.
I was in a really bad accident.
Okay.
And I think why Carolyn asked the question about paranoia.
Mm-hmm.
When I was younger, much younger, I smoked and had paranoia.
Right.
Never smoked again. I was scared of it.
Right.
After my accident, I learned about indica. It's more relaxing, so I tried it. And I don't really get high. I get rid of the pain.
Right. Exactly.
Once or twice I got a buzz, which was kind of cool. It was
Right.
different.
Right.
I tried it. I'm like, let me see. My
Right.
family's watching because I never had a drink. I don't do anything.
Right.
So my family was all around me.
Right.
Let's see this, and it's been pretty cool. So I've been using a vape,
Mm-hmm.
indica, THC.
Yeah.
Every night before I go to bed.
Good.
So now you guys know.
Yeah. Yeah. I
Every
would
night
say.
before I go to bed.
No
Which
worries.
has been great.
Right.
So I got everything. I got I went
card.
to a neurologist. No, I did everything. When I kept trying to put my information in, it was wrong. This week I found out they gave me the wrong birth date with the Jersey, with the government.
Gotcha.
So now they're going to get me a new one, but it seems to be an issue, so I'd like to talk to you about
Yeah, it's unfortunately that's common, and when I register people, I read through every specific word because I've had countless patients that have had that issue, and then you're delaying your medicine.
So I'll be honest, it's been months, but I've been getting it from a friend. I mean,
Right.
Now that,
Well, you got to do it.
Right.
Never, I mean, I had PTSD from my accident.
Right.
Guy tried to make a U-turn on FDR Drive. I was on my motorcycle, hit
Right.
me head on.
Yeah.
And I almost died.
That's going to be traumatic for
Multiple
sure.
surgeries, back surgery, knee surgery,
Yeah.
traumatic brain injury. Stuttered for 6 months, like the whole. But it's been so. In the interim, I'm getting it how I can.
Right.
And I didn't use bud until recently. I was scared.
Right.
I tried it and I actually like it better than the oil.
Yeah, I think the vaporizing it as a bud or a flower, as we call it. I think vaporizing it is one of the most effective ways when it comes to pain and anxiety. And so typically I recommend patients buy something called a Pax or something called the Mighty by a company called Storks and Bickel, because it reduces the combustion or the heat in your oral cavity. Because anytime you create heat in your oral cavity, you're creating something called oxidative stress. Oxidative stress is DNA damage. So oxidation is when a wrench rusts or an apple turns brown. When that happens to your DNA in any cavity that you have, that's going to leave you susceptible for your immune surveillance to not see that DNA damage and potentially cause an inflammatory condition. And so that's why we typically want to try to vaporize it, whether it's from a volcano, which is a specific device that can vaporize it, or another type of device just to reduce the heat in the oral cavity. But I do find that there is typically a better response to flower than there is to vape cartridges. And I typically recommend the vape cartridges predominantly for discretion, because you don't, people still have the paranoia, even if you have the card, that even though I'm using this as my medicine, I'm afraid that what if a cop sees me, or, we still have those things buried in some of our minds that,
And some of us have experiences, so even more reason to be worried about.
Right, exactly. I wasn't going to get into that, but
yeah, and so I'm actually over that part, believe
right,
it or not.
Yeah. Typically, people get over it pretty quick once you realize this is my medicine. Once
anyone who knows me is shocked.
Right.
I never did anything after
right.
the age of never, like I said, I've had a drink or anything. But the medicine, I'm an indigenous person, so medicine's big for us.
Yeah.
So I'm a little struggling a little now because I don't have the car.
Right.
So if I want to travel with it, I do worry a little bit, even though it's a vague.
Right.
I'll talk my way out of it, I'm sure.
Right.
But truthfully, I would like to be able to take stuff in a different form, maybe during the day.
Yeah,
work,
exactly.
In a different form.
Yeah, and
So
I'd be happy to guide
talk
you on
about
that for sure. Yeah, because I have a lot of people, that respond really well to the oral, oral variety of cannabis. Because when you're using oral, and it's perfect segue because now I'm going to talk a little bit about dosing. So it's typically condition specific, whether you're using CBD or THC. And typically you're going to want to deliver between 1 to 2.5, sometimes 5 milligrams of THC, and as an oral delivery, not as a smoked variety, because it's going to give you a more long-acting effect. So typically in traditional medicine, when we look at anxiety is the perfect example. If you have anxiety every day, you're given an antidepressant. The reason why is because it gives you a long-acting effect for that depression. But you're given also a short-acting medicine like a benzo to try and give you that 1 to 3 hour relief immediately, right? Well, when we use cannabis as a medicine, to smoke it is where we're getting that immediate 1 to 3 hour relief like a benzo for the anxiety or the pain, but using an edible variety is going to give us a more long-acting effect without the euphoria. And so that's the goal, is to try and use it as an oral delivery for a long-acting effect every 4 to 8 hours, and then using it as a smoked variety when we're in the convenience of our own home. Yeah, exactly.
That would be the happiest place.
Exactly.
I don't like medicine. I've had to take a lot of, I don't do it now, but I was taking a lot of ibuprofen for pain.
Yeah.
I wake up and I'm just,
yeah, and we know ibuprofen inhibits the absorption of various nutrients, and also modifies our gut microbiome, which also leaves us susceptible to various inflammatory conditions, including cancers and autoimmune disorders.
So you're taking it to cure one thing and it's causing another thing.
Exactly.
Right. So I'm looking forward to talking to you.
Yeah, absolutely.
No one's ever broken it. Even the doctor I'm seeing now, he's a neurologist.
Right.
We just basically gets you your
Just
card,
qualifies you,
and
yeah.
then you go down and talk to
Yeah.
them, which
just
I even
trying
went
to
to
sell you
Colorado, unfortunately for a bad trip, but I spoke to people there and I didn't get this.
Right.
which is-
Right.
I
I
haven't
mean,
met anyone yet.
Well, the doctor was also saying that that each state might have like Pennsylvania, Colorado, New York, New Jersey might have the same name for different strains of cannabis, and they're all totally different.
yeah, you'll have a different
So-
impact on OG Kush here versus Colorado
That's
versus
what I was gonna ask
California
you,
versus
when
New
you-
Jersey versus.
When you were giving these
Girl Scout
names,
cookies.
I was wondering that. I'm like, so they're the same everywhere?
They are
When
not
you're
the same
referring
everywhere.
to these, you're talking about here.
I'm talking about
Specifically?
I'm talking about what I'm using in New Jersey.
Okay.
Yeah, and what I'm using in Pennsylvania for my
Gotcha.
guiding my patients
Gotcha.
through that. Yeah. So yeah.
You can differentiate the strains though by getting the form from the manufacturer. right?
Correct. You can differentiate the strain if the manufacturer has a certificate of analysis to tell you, yes, this has a similar terpene profile as the one in, in Colorado or in California. But, I don't think many places are getting to that level, and I see that as the future of cannabis medicine.
So I'll tell you one thing, I tried a hybrid by mistake,
Mhm.
knowing I didn't want to do it, but my cousin was like, it's indica, don't worry about it. And I only took 2 hits of a vape. That's it. And I was like I started to get paranoid, and I worked through it.
Mhm.
Just 2 little. So there's just a hybrid. So I know that I can't be anywhere near sativa. I can't.
Hybrids are wild cards. The hybrids are total
You don't
jokers.
even know how they're.
You don't know how you're going to respond. You could respond one way and you're jazzed up and ready to go, and the person next to you is like, I'm not going to the club, I'm going to bed.
I was
Their
and I
companies
was
are
home.
walls.
Right, exactly.
And I was home, so I walked outside and I was like, what the hell?
Yeah.
But since it was only a little bit, I was able to, literally take my way through it.
You're not alone.
Because of my own paranoid experience from years ago,
Yeah.
I started to kick that out.
Yeah.
And of course, I got upset with her, and I called her son-in-law, who was the one that gave it to her. I said, no, that's a hybrid, it's not.
Right.
She doesn't know what she's talking about.
Yeah, hybrids are wild cards. So anybody out there, hybrids are combinations between indica and sativa, but in my experience, hybrids, it's going to either jazz you up or pull you down, or it's, going to level you out. I mean, it really depends on you as an individual.
Another question I heard just today, hybrid of 2 indica. Once they said hybrid, I was like, I don't want to have anything to do with it. 2 indicas? Hybrid, does that even make sense?
Yeah, it can happen. Yeah, absolutely. But I mean, once again, indica, when we look at genetic analysis of sativa and indica, indicas tend to be true indicas, but sativas are all over the map. So, that's why it's hard to differentiate using, a specific strain for a specific condition, and we need to try and do what's best based on the experience of the provider you're working with.
That's basically because the sativa has been more manipulated
Correct.
over the years. Indica is relatively new.
Exactly.
That was the 80s. Oh, indica.
Yep.
So they haven't had the time to really mess with genetic.
You got it.
I'm going to get
Yeah.
the information on that.
Yeah,
You
so
showed it
it's-
to me today.
Yeah, the genetic profiles of things are all over the place when it comes to sativas, but when we look at the genetic analysis and we look at it on a plot, we see that indicas typically stay focused in one area on that genetic analysis, but sativas are all over. Sativas are supposed to be down here on that genetic analysis, but they're all over the place.
I have
So,
no desire to get anywhere near it.
yeah,
I need this.
yeah.
I'm
And
already
then,
up here.
exactly.
Right, guys?
Yeah, I think most people are. You know,
I didn't see it.
typically with epilepsy, we can go as high as 440 milligrams per day, and we're going to be using up to as much as 100 milligrams a day of THC. Now, it definitely takes a lot of tolerance building to get there. It's going to probably take years to get to 100 milligrams of THC. Usually, the only way I can dose that for most people is by rectal suppositories at bedtime. Because they're just going to get knocked out. You're going to be groggy, but you're going to get the level of THC that you need. Typically, I have people buy molds off of Amazon and make coconut oil infused cannabis and throw it in the freezer. But we could also see pain and inflammation with CBD as high as 5 milligrams per kilo. So that's where it's really hard to use CBD as its own pain relief. You need THC to drive CBD into the nervous system. And so that's why, you know, you're going to use lower dosages of CBD if you have that little 0.3% of THC or a little bit more, even, you know, closer to an equivalent ratio. Anxiety, typically I find between 15 and 150 milligrams to be effective. One research study showed social anxiety improved with 300 to 600 milligrams. That becomes cost prohibitive. You're not going to use it as a medicine at that point. You're going to be spending, you know, a few $100 a month, if not more. You know, a few $100 a week, honestly, because the highest amount of CBD you can get is 3,000 milligrams in one bottle. And so if you're using 300 milligrams for anxiety, then that $160 bottle is going to last you 10 days. So just to put it in perspective from a cost purpose, you know, that's not going to be an effective therapy. You're better off using, you know, for anxiety, L-theanine or SAMe or GABA or, you know, anything else along those lines that are nutritional supplements that have evidence for anxiety. We see it good for Parkinson's, Huntington's, insomnia, MS. Again, with MS, we typically see 45 milligrams of CBD and 45 milligrams of THC a day. The research says 2.5 to 45 each daily, but always in a 1-to-1 ratio. And then with cancer, 100 milligrams of CBD and 100 milligrams of THCA. Not THC, THCA. So we try to get as much THC in as possible if that's all you've got. But THCA is the non-psychoactive part that's only found in the fresh state. Dry mouth, obviously. And then increased reaction time. So that's why we want to be cautious using this as a medicine while driving. And that's why I tell people to use 2.5 milligrams of THC at bedtime. See if you feel funny 2 hours later, or at dinner time. See if you feel funny 2 hours later. And if you don't, then you're safe to use it during the day and operate a motor vehicle. But speak with your medical provider to guide you through that. Now, we also do see that there's some impaired concentration in irregular users, but in habitual users, we see that it actually improves concentration when you use cannabis. We also see, just like alcohol, we see impulsive behaviors and impaired judgment. Duh. And then we can also see some anxiety effects that can worsen when you, and pain effects that worsen when you use. Yeah, that was total medical right there.
I took calculus in high school.
Right.
In college, the only way I got through was smoking weed before the class.
Yeah.
It focused my mind. It was
Yeah.
weird.
Exactly. I mean, that's right
But
for
I
a
was
lot of people.
habitual user.
Right, you were a habitual user at that time, right? So we'll talk about a little bit about safety. So with medical cannabis, once again, overdoses of THC can cause cannabis hyperemesis syndrome. So that's a cyclic vomiting syndrome that can occur from doing too much cannabis or THC-related cannabis. And so, like I said, I've had several patients that were dosed inappropriately from the pharmacists in a Pennsylvania dispensary and gave them high THC when they're cannabis naive, and it made them bug out. We also see that you should not be using a medication called bupropion or Wellbutrin, which is commonly used for depression and also smoking cessation. That can cause a very acute anxiety effects and also what's called serotonin syndrome, which is an overload of serotonin in the body, and it just basically causes mania. And so you should not use THC-related cannabis when you're using bupropion or also known as Wellbutrin. Now, if you are, I do have a couple of patients that are using it, CBD, but not medical cannabis with it, and it has to be 6 to 8 hours after you've taken that medicine. Because what it does is it inhibits the metabolism of the drug, and it increases the side effects of the drug. We also see a potentiating effect or an increased effect when it comes to benzodiazepines like Xanax and also Valium as well as Klonopin. And then we also see a more enhanced effect when it comes to opioids when you use it with cannabis. And so there was a study recently done that showed opioid users used less opioids when they were also using cannabis. And so that's because it inhibits the metabolism of it, stays in your system longer, and it makes it stronger. You also want to be cautious with too much THC in cardiovascular disease because it can trigger arrhythmias like AFib. It can also cause, if you have coronary artery disease and you have unstable plaques, it can cause you to have a heart attack or a stroke. And so that's why on all of my patients, I measure a marker called LP-PLA2 activity, as well as myeloperoxidase. These are markers in the blood that measure whether your plaque is stable in your arteries or not. If it is high, I do not use THC-related cannabis medicine. I use CBD first, and I get those inflammatory markers down first. Sure.
So basically, in the situation most people are in, they get a card, you go to the dispensary and just go for it.
Correct.
Like, so what is it that you do that, are you a pain medicine doctor? What is it?
I do everything. So I'm a primary guy. You know, I'll see anything that walks in the door. You know.
If I got my card, I went to the dispensary. And
Yeah.
kid is there, and he's like, "Oh, do this, and that."
Right.
I'm not getting.
Right. So the reason for the office visit fee that I charge, which is an initial office visit fee of $4.95 for an hour with me, is because I'm looking at your biochemistry. I'm not just talking to you on Skype or on the phone and saying, all right, $150, I'm qualifying you for cannabis. I'm looking at your cardiovascular risk factors. I'm looking at your hormones. I'm looking at other things that could be contributing to the inflammatory burden in your body, and not just saying we're only using cannabis. Cannabis is one tool in the toolbox. It's not the only tool. So when we have neuropathies, we need to look for blood sugar disturbances. We need to look for vitamin deficiencies, especially B vitamin, B12. If your B12 status is below 500, you can have neuropathies from that, even though the normal reference range is 200 to 1100. So that's why I dig into a little bit deeper, and that's why my fee is a little bit more than people who are just going to a medical marijuana doctor and getting qualified. Because I want to make sure that you're using this medicine safely. Because there's a side effect to every drug, and the toxicity's in the dose. And so I want to make sure anybody that I'm guiding in their health is going to be doing this safely, you know?
So does the fee cover the blood tests and everything that you have?
Yeah, the blood tests are typically through you billed to your insurance. Yeah. So this one's the reason for, and this was the one that seems to be helping you?
No, that's what my friend's thinks I should try. I'm
Okay.
showing it to you.
So I would be, you know, it could help with some of the anxiety effects, but the challenge is that I don't really know what the terpene profile is. So typically terpenes are those things that make it smell good. So seeing that it has citrus, it probably has some limonene, which is good, but you know, if it has anything that's going to be, so it has a derivative from Girl Scout cookies, but it also has a derivative from Kush. You know, so Kush is going to make you bug, but you know the Girl Scout cookies is not. You know, so I mean that's and bug out is the medical term for that. You know, you've been there, so you feel me.
We don't need me. You don't need me bug out.
Right.
And Sam, you had said that you do a lot of lecturing to other physicians
Yes,
on this topic.
I do, yeah.
So this is like your specialty.
Yeah, one of the physicians is in the house right now, Dr. Kelly Philippa, one of my best friends from medical school. So I'm happy she was able to make the trip down here and join. Yeah, I'm happy she was able to bring it down here and join us. Now the other thing we need to be concerned about is using cannabis as a medicine in adolescents, because that's the only population that's been found to have addiction when it comes to cannabis use disorder. So that's something we need to be aware of. And also, there's also a potential for lower IQ. So anybody under 18, that's why if it's regulated recreationally, it should definitely be under 18. Some specialists believe that it should be over 21 or over 30, because your brain develops up until you're 30 years old. Another thing we need to be cautious about, if we use it at all, is people with a family history of schizophrenia, because it can cause an earlier onset of schizophrenia. So that's something we want to be very cognizant of. Alzheimer's is type 3 diabetes, so no, it would actually benefit and help to prevent because it's neuroprotective. So we know that some of the amyloid plaques that build up in the brain as a result of Alzheimer's is related to blood sugar disturbances. So it's now considered type 3 diabetes. CBD is safe for...
Alzheimer's is now considered type 3 diabetes?
Alzheimer's dementia is considered type 3 diabetes because of its association with erratic blood sugars. Yeah. So that's why we want to make sure blood sugar is well managed. And my target for what's called the average blood sugar over 3 months, called the hemoglobin A1C, is 5.2 or less. If you have cancer, it should be 5 or less. Pre-diabetes is 5.7. So my targets are a lot more aggressive than what you would see on the normal lab reference range.
So my 6.3 is a little high.
6.3 is a little high, but cannabis use could get you down, So can alpha-lipoic acid, berberine, and if you have some neuropathies,
I don't have.
benphotamine.
I just had full medical.
Yeah.
The doctor's like, at your age, you should, have something.
Right.
Cholesterol, sugar.
That's good.
All my other stuff is good. It's just the A1C.
Yeah.
It fluctuates. It's been as high as 6.9 and it's been as low as 5.1.
So you need some berberine.
And berberine,
You knew that,
Berberine is an extract of an herb. The herbs are golden seal, Oregon grape, and also golden thread. Berberine's used in Japan as a substitute to metformin, and there are various studies that have been shown it to be equally as effective at metformin at dropping your A1C levels.
That's what they have in there, metformin,
Yeah.
500 milligrams.
Wow.
Yeah, just watch your B12 levels and watch your kidney function. You know,
B12, I get a shot.
perfect. Yep. So you're
My PCP is pretty good. He's pretty.
he's on top of it. If he's giving you B12 shots, he's on top of it. CBD, you know, we definitely want to be conscious of it saying full spectrum and giving us a certificate of analysis to make sure there's terpenes in there. We also, I believe that it's safe for anyone at any age. Even, you know, I believe it would be safe for once my daughter turns 1. And I think it's safe as long as you administer it under the supervision of a doctor. And you start low and you go slow. You slowly titrate up.
So giving it to your daughter for teething, I assume.
Yeah. I mean, you could do it for teething for sure. But you could also use it for sleep. Now the one thing.
That sounds like it's more for daddy than for the daughter.
That's for mommy and daddy. Yeah, exactly. So the one thing I wish everyone could see on the PowerPoint, maybe I can do this. There you go. So the one thing is that the toxicity of various substances is measured by something called the LDN50. LDN50 is the lethal dose that half of that drug would take to kill you. So when we look at this chart, we see that the LD50 for nicotine is by far higher than any other drug out there. So if you put a nicotine patch on a kid, you could kill him.
Exactly.
So the other things that we see on here, we also see caffeine is next, and then aspirin, Vicodin, NyQuil, Ambien, Tylenol, and alcohol. And then we see cannabis in green here. You would need to consume 80,000 pounds of cannabis in about 1 minute to be able to overdose.
Caffeine is second.
What?
Caffeine's
What's that?
Caffeine is second.
Caffeine is second in toxicity. So you can die from an overdose of caffeine a lot easier than many other
Every
substances.
summer, some kid is dying from doing a
Energy drink
while working out.
Yeah.
Yeah, that's what it is. Caffeine.
Yeah. So the reason for the lack of toxicity when it comes to cannabis as a medicine is because there are no receptors on our brainstem that will cause respiratory depression. And so that is why cannabis can be used safely without creating an overdose response, because there are no receptors that cause respiratory depression like these other drugs, like nicotine, like caffeine, etc.
Just go to sleep.
You're just going to go to sleep or you're going to bug out, basically.
We don't need bugging out. I'm bugging out.
The route of administration is through smoking, edibles, and oral capsules. Typically, edibles take 30 to 2 hours to onset. Smoking takes minutes, and then the capsules can take typically 30 to 120 minutes as well. Vaporized is by far the best. So you would want to use something like a Pax or a Volcano or a Mighty by Storks and Bickel to try and reduce the combustion or the heat that you're delivering that flower into your body with, because you don't want to create inflammatory responses in your mouth that could leave you susceptible to other inflammatory disorders down the road. The disadvantages is that, you know, you smoke it, it smells, tolerance does tend to develop, and so that's some of the difficulty. But the onset of action and how rapid it's delivered is definitely a big factor.
You said tolerance, but if you're taking it as a dose for pain or for anxiety, the tolerance still rises?
We don't see the tolerance rise when it comes to pain, but it can. Like the research, like I showed you in the Journal of Pain from 2019, showed that there was no tolerance with migraine headaches developing, but we don't have the data to tell whether it's going to develop tolerance in other people or not. But occasionally when you smoke it, you're going to need, instead of it lasting 2 to 3 hours in a regular, the strain that you're using, that's why you may need to rotate strains, or you're going to need to use the strain more frequently. But my preference is to use an edible for more of that long-acting effect, and I'm not seeing the tolerance when it comes to the edible variety. We also have solvent extracts, which have been the way that cannabis has been delivered historically forever, and all plant-based medicines, so that's the way I think would be ideal delivery. The challenge is that everybody responds differently, because edibles convert to delta 11 THC. Delta 11 THC can cause people to have no response or a 300 times greater response to whatever you would be delivering in the smoked variety. And so it's very individual when it comes to edibles, and we need to make sure that we're doing it safely and starting low and slow.
So that was, I mean, I remember reading when they made legalized marijuana in Colorado, there was a great influx of people going to the hospitals, and it was mainly from eating edibles. So they were eating what they felt was a good dosage, but it was that much stronger than normal.
Right, and the other problem with Colorado when they had the edibles there is they put the maximum limit on 100 milligrams per item. And so you put 100 milligrams of THC in your body, you're going to bug out if you're a regular habitual user or you're, new to it.
You're eating 5 gummy bears instead of
right, exactly. So
I just brought up another question because I have a few people that are fast metabolizers. What percentage of the population has that, and how would it affect them?
So fast metabolizers are typically going to have a quicker onset of action and a less of less of a sustained impact. I would say in my practice, I see sensitive people every day, and so the fast I'd say probably 1 out of 10 of my patients is a fast metabolizer. So in the overall population, I think it's low, but the people who seek out the type of care that I provide, we're seeing those strange, rare, and peculiar cases. You know what I mean? I think it's probably 1 out of 100 people probably are fast metabolizers in the general population, but I'd say in the people I see, it's probably 1 in 10. So out of the 60 cannabis medical marijuana patients I have, because I've only been doing it I've only been qualifying people at my office the last 6 months, I'd say, and we're not marketing too much at all, and people just want to get their card and not get the whole workup, but I would say that at least 1 out of 10 of each one of those users that I've worked with is a fast metabolizer and have an adverse reaction to an oral cannabis delivery.
So what would you recommend for somebody like that?
The liquid.
Edibles?
It would be the liquid option. Yeah. Unfortunately, in New Jersey, there's very few dispensaries that have that tincture option. Tincture is an alcohol extract of cannabis. But when you're able to get access to it, Breakwater does have one. They're in Woodbridge, so they're not terribly far from where we are here. But I'm typically going to do drop dosing with that population. And I'm going to start with more of a balanced ratio. 1 THC to CBD instead of going 10 to 1 THC to CBD because of that rapid metabolism. Because those are the people that are going to have that 100 to 300 greater times response to the THC than the other people who aren't. And honestly, sometimes I just stick with CBD for those patients because you can get similar effects. It's just you're going to need to get to a higher dosage, unfortunately. But then it goes back to our question of what's the right CBD for them, and then you need to really look at the terpene and the cannabinoid profile at the end of the day. So metabolism, it does get metabolized by a variety of drugs. Topamax is another drug we need to be conscious of. That's a migraine headache drug that we need to be very conscious of using THC cannabis with, as well as, like I previously mentioned, benzodiazepines, Klonopin, Xanax, Adderall. Adderall is a different drug, but we do see that is also sustains itself in the body, as well as opioids. And so we need to be very cautious using cannabis with Topamax and also with bupropion or an antidepressant like bupropion, also known as Wellbutrin, because it can worsen suicidal ideas as well as arrhythmias and headaches and agitation. There's also, we need to be conscious about the synthetic cannabinoids, things like K2 or Spice or Joker or Black Mamba, not Kobe, rest in peace. But those are the things that we want to watch out for when it comes to fake cannabis, because there's likely about 177 different synthetic cannabinoids being identified in these formulas, and there's over, from a 2011 study, there was over 28,000 visits to the emergency department as a result of using these things, and in 2018, they found as many as 3% of all 10th and 12th graders are using these synthetic cannabinoids. So I'd rather, and the problem is that it has unpredictable effects, causes a lot of nausea, vomiting, suicidal ideas, paranoia, rapid heart rate, and agitation. A lot of times it's also made up of shredded, dried plant materials and man-made chemicals, so we want to be really, really conscious about that. So that's all I've got. It's pretty heavy. I hope everybody enjoyed what we had to offer. It's a little heavy. Like I said, I usually do this lecture for providers, but I decided never to dull it down because you never know who you're talking to, and I'll throw it out there and we'll see what sticks. So thanks everybody online for joining us. Hopefully you learned a few things, and hopefully I'll be back soon.
Thank you everyone for joining us. I saw so many people have been sharing this, which is amazing. So, Kyle, I'm sure you've reached probably hundreds of thousands of people, which is pretty amazing. And I learned a lot, and I hope you guys did too. You know, keep the questions coming. I'm sure there's going to be a lot. We'll answer as many as we can. We'll forward to our dear doctor. Thanks for showing up. This is really important information, and you know, so many of us suffer from these chronic conditions that can be treated naturally. And to know that you may be able to get off the medications you have or not even need them is really powerful. So there are options that are out there for you. We love you all. Thanks for joining us on Wellness Wednesdays. Bye, guys.
Thanks, everybody. Take care.
Yeah.